So root canal treatment or endodontic procedure is one of the most common procedures in dentistry. It is a treatment done to actually save your tooth when your tooth is infected with either caries or commonly known as decay, or if you've got cracks or history of trauma as well, and your tissue inside gets infected. So root canal treatment essentially is a very predictable treatment to retain your natural teeth. But although it does have several steps that you need to follow to get to the right outcome, and that means all the way from a diagnosis, treatment planning, using the right tools, armamentarium, etc., which we do at Opus, and is ensured that we do it at the highest standards possible. That's also recommended by the international societies and the leading ones especially. So I'm going to explain to you in general what a root canal treatment looks like on an X-ray. Just going to break it down very simply. So if we have a look at the image on the top right corner over here, so this is the tooth in question that we're going to be looking at. So of course, to a patient, this just looks as like black and white lines, but it has a lot of meaning, and we're going to try and just understand that in a much simpler format. So this is the tooth in question. As you can see, this top part over here, this is what you as a patient or me as a dentist would see in your mouth. That's your tooth that you see that's got enamel around it and dentine and pulp underneath that. So this tooth has got this restoration over here, which you can see is not present on the adjacent tooth here. This is an unrestored tooth. So this has some sort of a filling. Under this filling, there is an enormous amount of decay. Now this decay is really encroaching very close to this black space here, which has these black lines that go down down this tooth. So that essentially is actually a root canal system that's got your nerves and your blood supply. When decay or bacteria gets ingress into these spaces, patient will normally have inflammation and pain, and therefore will come running to your dentist to get some kind of treatment done. So what we do in root canal treatments is, first things first, we have to take out your existing restoration, take out the decay, have a look at how much healthy tooth structure is available to us. That's number one. Number two, see are there any signs of cracks or fractures as well, and is this tooth actually salvageable? Is this restorable? Is this worth putting back into function in your mouth again? So what we essentially do, as I said, first things first, restorability assessment. We take out all this stuff, clean that up really well. Following which we drill into your tooth and try to get access into this black space over here, which is your root canal system. Once we do that, we use motorized equipment to clean the space out really well. And we use a disinfectant, which is essentially bleach, to disinfect the space really well. Following which we fill it up with an appropriate root canal filling material. So you can see these white lines over here. This is essentially root canal filling material all the way down to the tip of your root, which means that we've reached the right length, homogeneous in terms of the condensation as well, and this is a restoration that's been put on top. So all in all, I'm quite happy with how that treatment looks. Right guys, so this is actually one of my favorite parts about the age-old question about the benefits of a root canal treatment, and when do we extract and why not go for an implant as well. So of course, saving your natural teeth is of the utmost importance, because it's better your natural tooth is your best implant. But of course, you save these teeth or save natural teeth where sensible, where pragmatic, and for the long-term survival of these teeth. So why is it that there is always a debate that, should I take this tooth out? Should I go for an implant? Let's be very honest, everything is plausible to fail. Okay, people talk about root canal treatment versus implants. I think the best mentality or ideology behind this debate, and put it to bed or put it to rest, is to rather say one complements the other. So root canal treatment done on a tooth might last you for a very long time, following which unfortunately may have to come out because teeth do get weakened, and they do form cracks or fractures in the future, and they have to get pulled out. It's not always the case, but it can be the case, following which these teeth will come out, and then you may have to go for an implant. But implants also fail. Everything has a survival, everything has a success rate, everything has a durability. So younger the patient, the more beneficial it is for you to prolong the survival of your natural teeth and not directly go for taking these teeth out. Right, to answer your, or the most common question, or the most common misconception rather, that are root canal treatments painful? So to be very brutally honest with you, 95% of the time, if done correctly, these treatments are not painful. Of course, everything has to be done with anesthesia. Even if someone says that you may not need it, or a dentist may say they may not want to give it to you because they think it's going to be fine, you need anesthetic no matter what root canal procedure you're going to be getting. So if anesthesia is given properly, if the tooth is numbed up really, really well, the procedure is going to be seamless and you're going to have no pain. Yes, you could have a little bit of post-operative pain. That's only because you've done so much to your body. Your body will react in a certain way. It's like basically when you have a cut on your arm and you need some sutures, for example. The sutures are going to benefit the healing, but you're going to have some soreness. Now, what about during root canal treatments as well? Is that painful? As I said, 95% of the time, it's not painful. But what about the 5%? 5% unfortunately does happen, and that is because sometimes the tooth is so inflamed from inside, your tissue inside or your blood supply or your pulp inside essentially is so inflamed that it is very, very difficult to actually anesthetize it. But this is where patient communication comes into play, because you need to have a chat with the patient. You need to explain to them what they may have to expect, what may happen, which psychologically also benefits you in a certain way. So you're not really going to go into a surprise and going to go into a lot of pain. One of the people just who's a part of the team and part of this whole setup for the recording was quite mesmerized an hour ago when I was working on a patient, and just asked me that what was that big thing that you were looking down and working on a patient. So that, my friend, is a microscope. So microscope is a device which is used for magnification, for better accuracy and optimization of treatment as well. And that's what we have here in Opus. It's not only for root canal treatments. I use it for all root canal treatments and surgical procedures, but also for bare basic diagnosis as well. Because there are a lot of things that your naked eye unfortunately cannot pick up, and a microscope enhances that by 25x. So you get to see much more clearer, you get to see much more, you get to pick up things as well that will impact the diagnosis, your treatment, and inevitably the outcome of the treatment as well. So microscope in root canal treatments, there's this root canal treatment essentially is such a small part of your body that we have to dive into and do so much work in there, and you really can't see much with your naked eye. So a microscope really aids in that. It helps in locating cracks. It helps in finding extra canals that may be very difficult to locate as well, missed anatomy, or finding complex anatomy, or also things like taking out decay that may be hidden in corners that may tend to grow over time and cause more breakdown of your teeth. So there are many benefits of using magnification in everyday treatment. Because I mean, it's a known fact, you can't treat what you can't see, and anything without that, for me personally, is a blind treatment. If you can't see something, you can't treat it. So that, my friend, that's what a microscope is. It also helps in tooth preservation, increase accuracy of your treatments, and helps you be minimally invasive at the end of it. The more preservative you are, the higher the chance of success and survival of the teeth or treatments that we do in daily practice. And also we do have a camera attached to the microscope as well, through which we go through a lot of documenting processes, not only for educational standpoint but also for patient education as well. So what it essentially does is that we record things while we are talking to the patient while looking at the microscope, and then we can put it up on the screen to show them the actual problem, what's actually going on, any mishaps or complexities as well. So that way it's very transparent between the patient and the clinician as well. Expectations are set from the very get-go, and I think patients understand much better as well when they are explained in such a way, when they see things rather than just being fed information verbally. And lastly, also it really helps with consent as well. Communication with the patient is one thing, but also when it comes to consenting a patient for giving the right information, for them understanding and knowing what the gross reality over here is. So yeah, just to conclude, all the points that we've spoken about is that root canal treatments, if done correctly, are not painful. You need the right dentist. You need the person who you trust as well, and who can communicate this to you very well. Number two, to always preserve your natural teeth. The longer you can keep your natural teeth, the better it is. It's never root canal treatment or implants. It is root canal treatment followed by implants if required in the future. Your natural teeth are your best implants. And also, in terms of standardized healthcare, we do provide the highest level of standards when it comes to endodontic procedures at Opus Dental Specialties.